Hypertension or high blood pressure is characterized and diagnosed based off of an increase in blood pressure that is taken over a standardized period of time. So that gives us multiple blood pressure readings to be able to come to an actual diagnosis versus just taking into account one random blood pressure and giving the diagnosis of hypertension. So let's talk a little bit more about what that means. Hypertension can actually be broken down into two categories: primary and secondary hypertension. Primary hypertension, the etiology and the pathology is still a little not fully understood. They call it the silent killer for that reason, that we're not really sure why it affects us the way that it does and where that it's actually coming from. There are some theories that are saying, and some studies that are saying that it is actually a genetic markers and that actually predispose you to hypertension with your genetic makeup. That being said, it's still kind of one of those things that isn't fully understood. Secondary hypertension, which is the other category, is a little bit more understood. It is directly related to an underlying cause. So it is either related to another disease or another type of illness, or sometimes drug use, things like that. We know that that is where the blood pressure is coming from. Usually secondary hypertension affects people that are a little bit younger. Primary hypertension usually is a little bit for older, because it's something that we stumble upon without knowing why it's actually happening. With that being said, there are different things that why blood pressure affects our bodies and what it does, and why it is of such a concern and from a healthcare standpoint. Blood pressure actually affects every single vessel within the body, also affects the organs, but where it causes the damage are on all the vessels. So what we're thinking of is arteries and veins, all of the things that supply all of our really important organs with our blood get damaged over time when we're not managing our blood pressure. So what that means is the vessel itself gets stiffer and harder, and it makes it harder for the blood to flow properly. What that also means is, because it's making it harder for it to flow, it flows slower and it can get clogged, and things that also can get in there with our poor diets and not exercising and things like that, our lifestyle choices can contribute to something like a clot. Where the blood pressure comes into effect is with a healthier diet and with some exercise and controlling your blood pressure. That decreases the risk for those clots to manifest either like a stroke or an ischemic heart event, some sort of damage where we clog that blood flow because of the stress of the elevated blood pressure and our poor dietary choices, whether that be fried foods or alcohol, different things that are affecting our bodies poorly. Then we add that in with uncontrolled blood pressure, and that increases our risk where those arteries, veins, all of those vessels already can't flow properly because of our elevated blood pressure. And then we add in our poor diet. That just increases our risk of having some sort of catastrophic event like a stroke or heart attack. Those are things that I would be concerned with, especially within this case, because we have a stressful work environment, we have poor dietary choices, we have weight gain, we already have uncontrolled hypertension or high blood pressure. So things that I would try to address or try to help provide a little bit more knowledge of are lifestyle changes and trying to maintain that blood pressure so that we can hopefully prevent things in the future.